Well, I think that health literacy is linked to the public health in all possible ways. It starts from the individual. So if our individuals are health literate and they can first of all understand what they learn about health, and then if they can act according to what they are learning and moving that to action. So I think that is the starting point. So individuals' health, but then also that is growing and building up to public health in that way then. So I think that is actually it's not a synonym, of course, but it is something very close to that. Well, in different parts of the world they are quite different, of course, and my perspective is the northern countries' perspective, and in Finland I think one of the priority areas is the elderly. We have a growing population of elderly, and so we need to support their health literacy, to support them to be able to keep up their own health and act for their own good. So we need, for instance, teach how to use proper medication and in a right way, and how important it is to continue with your medications. Also how important is the nutrition and physical activity and maintaining physical activity in order to be able to stay at home, which is the wish of most of the elderly. So in a way, I think elderly is one group. Then we have the unemployed and people with that are in risk in marginalization. So I think that those two groups are such that need special support. When you don't have a motivation in life, like work is for many people, at least in Finland, where you are sort of assessed by your work ability and work. So supporting these people to find motivation in life, and also then keeping up the health with routines and physical activity, again there keeps you maintains you in so that your workability is maintained. So in a way I think that's another group. And then the third group that I think we have in northern countries is the children at risk of marginalization. So children in families that have poor health status or low income or are unemployed or have other social problems. So those groups are the ones that we really should target on and put our actions into. We have also problems like alcohol and abuse, not abuse, but
addiction.
Addiction and using these kind of addictive stuff. So that is a group that needs special attention in our country. Of course, the problems are different. We have areas in the world that it's more important to look at epidemiology, epidemics that have diarrhea and stuff, but we don't have that kind of problems in our country. Well, the initiative that my group has been taken is now to look at the new digital technologies and how we could use them and how we could put them into action to promote health literacy and healthy lifestyle. So we have developed different health games for children and their families, and we try to support healthy habits with those, and also try to measure and show families where their efforts should be put on. So not every family has the same problems, and not everybody has any problems, but those who do, so we try to help them to realize that there is something that we could change in our lives, and then we give them tools on how to help, how to change. And these are now digital games that we are concentrating on. It's not a solution for everybody, and it's not like the best solution in the world, but it is one solution, and it is one tool that our future generations are really capable of using, and we need knowledge on how to put it into positive use and not only negative in that way that people are sitting by the computers and using their time sitting, but we try to put the computers into such ways that they activate the families and children especially. Well, I have thought that there are like 3 levels of actions, and I would give some examples of each of them. So first of all, in a strategic level, I think, and I mean like municipal strategies or even politics in country level. So I think that one idea that we are trying now in Finland is that we are combining social and health care together. We are putting them together, and I think that that's in that way a clever idea. Of course, we don't know the results, and there are not really good examples about that yet in the world, but we have decided that the governance of health and social and also the actions in the local communities are going to be put together so that social workers and healthcare workers are working together, and probably in this way we will get better municipal health ideas and social ideas when we find the marginalized people, and then we can help also their health habits. So that's one point. Then on tactical level, which is not anymore the strategic thinking, but the tactical level, so the level where people are working. So I would say that one of the clever things to do would be to put like a multi, inter or transdisciplinary working together, so that people would try to work together, and not only the professionals, but take the stakeholders, meaning the families and the children and the local community, to be together with that. So I think that that's also like a good opportunity. So I would call for more transdisciplinary working together. And really in this way, if I think about all the research and what I have been doing in my life and the projects that I have been working in, so I think that one big issue is that when people are listening to each other and learn from each other, so then they understand each other better. And this is actually very simple, but it is so difficult if we think how difficult it is in this world to get people to listen and work together. So this is a huge challenge, but I would say that it would be anyway good. So working together. And then I have the idea that in individual level, we should start building the health literacy skills already from the very beginning. So actually teaching the mothers about breastfeeding and how important it is to children, and then from that on so that we would support the health literacy in all possible ways that the municipalities can do it. So in schools, kindergartens, maternity care, and then all the way up to whenever you finish your education and start working, and even then probably. And I would say that we should have to not only target on the knowledge level, but also in actions and functions, and so that because other people like different things. I am a kind of person that likes to read and learn from reading, but I know a huge amount of people that hate reading and they would like to learn in another way. So I think that we should use more imagination on how we could get the individuals to learn, like by cartoons and movies and TV programs, and of course then now the digital world is going to be a huge possibility, and we should just use our imagination that we can get it work in a way we like.